Good evening, all. Welcome to you all on this Masterclass in Pharmacy Practice. And I would like to tell that today is lecture number 15 and 16, and it is medication adherence. So, typically, we will see today what is medication adherence. So, at the outset, I welcome you all. My sincere acknowledgement to Shri Praveen Gargji, Chairman, ISF College of Pharmacy, Engineer Janesh Gargji, Secretary, ISF College of Pharmacy, as well as Chairman, TLF School, Professor G.D. Gupta, Director and Principal, ISF College of Pharmacy, for his constant motivation and guidance, Professor R.K. Narang, Principal, ISF College of Pharmacy and Research, all the heads, students, and dear participants of this masterclass. So today we will start with the medication adherence. Medication adherence is very one of the important and significant thing in continuation for the therapy. Okay, so in this context, when we take medicine, it should be a course of duration, say 3 days, 7 days, 14 days, 28 days. So if we are not continuing it properly for the written time by the physician on a registered medical practitioner on a prescription, at that time the problem occurs. So this process where we are making some methods to take medicines regularly is called as medication adherence. So understanding one point in our context is just to understand that medication adherence is very important in our life. So there are some market preparations available for medication adherence where morning time, evening time, noon time, and night time you can take the medication. So in this concern, Pill Pro is available in the market, like you can see on your screen. And this in this screen you can see that particularly the week is starting from Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, and Saturday. So at a very onset of time, every day is divided into 4 parts, and from this 4-part category, you are able to take medications at a proper time. So this is how the market is playing. Now another, we have one dosage box, and in the dosage box you put the medications for elderlies beneath the pillow. So in nursing care homes, this is very famous and popular type of thing, dosage box. So for a week entirely you are putting this, and this is very much I would say that helpful for the elderly or geriatric patients. So this way you can see on the screen, this pill boxes are available to understand, to create the proportion of this way. So in that context, particularly we have the Pill Pro, and in the Pill Pro we are looking after the medicines. So Pill Pro is available on the Amazon, and in the Amazon you can particularly use these medicines for use. And why I'm telling these things, because once at a concentrated level where we have to use the medicines, we have to see the medicaments, it should be on a regular interval of time. So in the hospital, what happens, automated machine cabinet is there for the medication adherence, giving reminder to the nursing patient, or you have fulfilled a particular kind of update for the purpose. So this machine is also called as a crash card. In some cases likewise. So crash card is an emergency counter where the emergency medicines are stored in a proper manner, so that we can particularly use it for the further purpose. So this is the one of the crash card which is used with automated external defibrillators. So somehow we have zero line medicine called first aid. Then we have first line, second line, third line, and emergency line. In the emergency line, this crash card is used as per the emergency pre-hospital emergency manual, 108 ambulance. This is the trolley tray used. Some medications having backside printed medication adherence counter. It's like can see this is for RNDCP program, anti-tuberculosis medicines molecules. So drug distribution is done in outpatient, inpatient, online, generic drugstore, controlled drugs, inpatient, and various resources like British National Formulary, British Pharmacopoeia, Homeopathic Pharmacopoeia, National Formulary of India, SIMS, MIMS, Drug Today, NFI, etc. are there. So altogether, the medicines are given into it. We need to go with the physician desk reference. Physicians used to write the medications for the patients. And patients have to take it properly for the 3 days, 7 days, 14 days, or 20 days, whatever it is written. So full compliance of the medication order should be there. Some causes are there like patients, healthcare system, therapy-related, condition-related, and patient-related problems. So some disease, illness, symptoms, lack of symptoms, severity, medication, complexity, duration, unable to understand what kind of administration techniques to be adapted to take the medications. Then healthcare systems, lack of care organizations, access or more number of patient pool, less number of paramedical and medical staff is also another one example of healthcare system problems. Demographic and socio-economic factors like level of education, marital status, cost of care, pharmacoeconomics. Patient close relatives are another example. So we have to have the access, affordability, education, a routine, a support, and a monitoring system. So the 5 dimensions or 5D, 5R, right dose, right route, right person, right diagnosis, right medicines. So same way, 5 dimensions of medication adherence are also there. Social and economic status, where everybody are affordable to the medicines. Medicines should be available. It should be having particularly medicine cost, and healthcare systems, patient-provider relationship, long wait times should not be there, lack of care continuity restricted, then the condition related, then therapy and patient related. So what are the various indicators and predictors of non-adherence? People are fear of taking the medications due to side effects. They have a psychological distress. They are having lack of insight into the disease. And there are some barriers access to care, like barrier access to care means some people are knowingly or unknowingly not eligible for this kind of control process. Cost of medication, they are not knowingly cost of medications. And lower cognitive function, they think if we administer more medicine, our neuronal activity will be reduced. Complexity of medication regimen, if you are taking more number of medications, so there will be definitely some resistance in the body. Then lack of belief in treatment, so whenever you left against medical advice, treatment, this kind of things too happen. So various like factors, you can see beautiful chart where the therapy related, patient related, condition related, socio-demographic level, low income, this literacy status, and people living in the shelter homes, people are doing the this kind of on daily basis they are earning and cooking and taking food. So the lack of interest in the system, very young or very old adults, transportation in the rural residents are the problems. Whereas therapy related, treatment of failure, complex regimens, treatment changes, adverse effects, refill frequency and consolidation, treatment duration. Whereas in patient related, they forget to take the medicines, deny the diagnosis, perception of illness severity, lack knowledge, alternative therapy, limited follow-up, fear of adverse effect. Condition, reduced quality of life, symptom severity, multiple chronic condition, depression, psychosis, and dementia. So methods for detection of poor adherence may be qualitative and quantitative, where the interview, questionnaire, or drug assay is a qualitative method, whereas the quantitative is pill count, refill data, directly observed treatment, dots, electronic monitoring, or digital monitoring. So at various level, physician level, patient level, healthcare level, pharma company level, we need to see that we have to adopt some strategies and the methodologies to fulfill this kind of problems. So for physician level, patient counseling, feedback on clinical and behavioral improvement, identification of adherence related issues, involvement of healthcare personnel, improving health literacy of patients, reducing pill burden, self-monitoring of BP, telemonitoring, reminders, apps, motivation, incentives in insurance premiums, priority physician visit, etc. Social support, family engagement in treatment, supporting the development of monitoring systems such as telemonitoring, availability of national prescription databases, increased medication accessibility, increased population education and awareness about hypertension and treatment. Pharma companies like packaging, development of digital medicine, monetary incentive and drug refills, patient educational activities. So at the right dose, at the right interval, for the full time duration and follow the instruction is the medication adherence. So the patient lacks the motivation therapy or the theory of protection and motivation. So motivation is given to take the medicines, the efficacy of response, perceived severity, perceived susceptibility. So for medication adherence, there are several techniques. As you can see a wonderful pictogram onto your screen where we have to write down at some place the time. You have to report the side effects or any adverse drug reactions. Like today we inaugurated the National Pharmacovigilance Program, 5th National Program, where we have gone with the ADR reporting process and told what is the significance of these things. Set a routine, build reminders in the phones or your bedside, any mirror or refrigerator door you can put. So the reminder alarms and dosage box, stick with a schedule. So that is why the dosage box are prepared where the noon time, morning time, evening time, night time medicines are stored. And use the one pharmacy only so that your medicines and your habits are known to your family pharmacist. Then follow up and share your concerns to the peoples. So what happens in this therapeutic education is required, treatment regimen simplifications, maximizing placebo, minimizing nocebo effects. Nocebo effect is a negative effect of the placebo. Minimizing treatment costs. So pharmacoeconomics, early follow-up visits are term treatment goals. So strategies to be adopted for reminder programs like mail. So a planned mail. Okay, then phone calls, text messages, smartphones, applications, etc. can be embedded. So as per the Mosby's medical dictionary, adherence is defined the process in which a person follows rules, guidelines, standards as a patient follow prescription and recommends for a regimen of care. So self-management support system like demonstrating a new skill like taking the puff in case of asthma or taking the insulin in case of diabetic patient. And praise and feedback, then self-management where you check up Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, the pill boxes. And the chronic care model where you need to understand that community health systems, everyone is involved, patient-centric, efficacy, evidence-based, safe, coordination, all about patient and fully prepared, proactive practice team, all are required. So medication adherence is 50% with comorbidities and adherence is required. So 5 dimensions of the medication adherence: social and economic, patient-related, healthcare, therapy, and condition-related. So wonderfully, you have to take care of the elderly, you have to take care of the adults, you have to take care of the acute, subacute, chronic conditions, you have to take care of emergency line conditions, you have to prepare some leaflets. And as rightly said by our things a great physician is, Hippocrates was the first to note some patients did not take their medicines as prescribed, and that is why the Hippocratic oath is written. So Hippocratic oath is considered as father of medicine, Hippocrates. So if the medicine is not working, the patients will not take. As given by a general surgeon, Colonel Everett Koop, who was an MD in the United States, 1985, stated that drugs don't work in the patients who don't take them. So the proper concordance, persistence, compliance, and adherence comes up. So they look us like Lassa drugs, they look alike, but every words have different meaning. So they impose views between the patient and the healthcare professional. Collection of medicines from the pharmacy, they are appropriate in time. Now, what is compliance? Compliance is to complete an action, transaction, or process to fulfill a promise, following of instruction given by the prescribers. What is concordance? The prescriber and patient come to an agreement about the regimen patient's views on medication taking behavior. What is persistence? The ability of a person to continue taking medications for intended course of therapy. What is adherence? Patient participation and treatment as a shared decision-making process. The patient is under no compulsion to accept a particular treatment, but yet he or she takes the medications as prescribed by the registered medical practitioner. So in the past, there was only one word used, compliance. So compliance was increasingly replaced by adherence. Concordance is not a synonym with either compliance or adherence, but Concordance, as I earlier told in the slide, is that to complete an action, transaction, or process to fulfill a promise following the instruction given by the prescribers. Whereas patient medication taking behavior is noted. So interaction between clinician and a patient nature to note down to observe this whole process is called as predicting the non-adherence matter. So, despite the ongoing debate, adherence has been referred term for WHO, American Pharmacists Association, US National Institutes of Health. So, the extent to which a person behavior in taking medicine, following a diet, or executing lifestyle changes corresponds with agreed recommendations from healthcare providers. So, this is adherence to long-term therapies. So, what happens in the impact of non-medication or non-medication adherence? There will be a disease progression and complications, increased healthcare cost, decreased quality of life, prolonged hospitalization and long-term care admissions, patients' death. Non-adherence around the world, the extent of adherence varies widely, and studies have reported as low as 10% up to 93%. Approximately 50% of patients are non-adherent to chronic medications. In developed countries, non-adherence to long-term therapy is 50%, much higher in developing countries. Of all medications-related hospital admissions in the US, it is around 33 to 69%. So patients' behaviors towards taking appointments and treatments when they are at symptomatic level, diagnostic level, early treatment level, continue level, or they are at the emergency line or risk. So on that particular time, we need to see that, we need to understand that general patterns of taking medications among patients treated for chronic illness who continue to take their medications, almost preferred adherence to a regimen, taking nearly all doses, miss a single day dose, occasional omission of doses, frequent omission of doses, take few or no doses while giving the improvement or impression of good adherence. Now, for reasons for non-adherence are intentional medication non-adherence. People will not take medicine intentionally. Some may forget, so unintentional behavior. So why patients are having difficulty in the treatment? So clinician, physician, healthcare system, socioeconomic, therapy related, every. Now, in the social and the economic dimension, language barrier, lack of family or social support, unstable living conditions, homelessness, limited access to healthcare facilities, lack of healthcare insurance, inability or difficulty assessing pharmacy, medication cost, cultural and lay beliefs about illness and treatment, patient-related dimensions. They are having lack knowledge about the disease. Understanding reason medication is needed. Expectations or attitudes toward treatment, perceived benefit of treatment, confidence in ability to follow treatment, fear of possible adverse effects or dependence, frustration with healthcare providers' motivation, physical factors, visual impairment, hearing, cognitive impaired mobility, swallowing problems. Therapy-related dimension, complexity of medication regimen, number of daily doses, number of concurrent medications. Treatment requires mastery of certain techniques like injections, inhalers. Treatment interferes with lifestyles or requires significant behavioral changes. Duration of therapy, frequent changes in the medication regimen, lack of immediate benefit of therapy, side effects. Condition-related dimensions, chronic conditions, lack of symptoms, severities of symptoms, depression, psychotic disorders, mental retardation, developed disability. Healthcare system dimension, provider, patient relationship and communication skills, lack of positive reinforcement from healthcare provider, weak capacity to educate patients and provide follow-up. Patient information materials are written at too high literacy levels, so the normal way patient information leaflets to be prepared. Lack of knowledge on adherence and of effective interventions for improving it. Restricted formularies, changing medications covered on formularies, poor systems or missed appointments, long wait times, lack of continuity of care. Now, methods of measuring adherence, there are some methods like direct methods. So direct methods, directly observed therapy, most accurate. And sometimes the patients hide the pills in the mouth. You might have seen the movie of Salman Khan named Kyunki. So Kareena Kapoor and Jackie Shroff is acting as a physician in that movie. So when they come for the ward round in that movie, particularly Salman Khan puts the pill in the mouth, and when they go, he puts out that pill outside the mouth and throw in the dustbin. So it's a patient-related behavior. Then the measurement of the level of medicine or metabolite in blood. So variation in metabolism and white coat adherence can give a false impression of adherence. Then indirect methods, patient questionnaires, pill counts, rate of prescription refills, assessment of the patient's clinical response marker, electronic medication monitors. So medication event monitoring systems, MEMS, track cap is also used, where daily you have to particularly opened up through microprocessor technology embedded in the cap. So it can be easily manipulated, very expensive, and different devices are needed for each medication, and it's inaccurate. So there are some other methods like medication position ratio, CMA, continuous multiple interval, user of medication equestation, pill count method. And there are various questionnaires also, brief medication Hillbone, 8-item Moresky medication adherence are the widely accepted questionnaire, medication adherence questionnaire, self-efficacy, medication adherence report scale, etc. So improving medication adherence for elderly, short-term treatments, long-term treatments, intentional non-adherence, unintentional non-adherence, where we have to do in older patients for adherence, assessment, individualization, documentation, education and supervision is required. So in this intentional and unintentional non-adherence, we have to give the motivation. For that, technology, mobile apps, simplification of regimen, drug packages, proper counseling, directing, advising, supporting, encouraging, motivational interviewing. Motivational interviewing for improving intentional non-adherence method used to explore the reason for barriers to medication intake intended to stimulate behavioral change, increasing knowledge about the disease and its treatment, explore patient concerns or fears about potential side effects, motivate them to resolve their problems and prevent future intake problems. Now, roles of pharmacist in the medication adherence, and into it, the best known function of the pharmacist is medication dispensing, but pharmacists also have to counsel improving patient care. So as a social pharmacy links clinical pharmacy, we have to pharmacist prescriber or pharmacist patient communication lead to significant breakthrough. In community, ambulatory, hospital, clinical, hospital, Janaushadhi Kendras, generic drugstore, everywhere, OTC drugs or prescription drugs, speed drugs or OTC drugs, everywhere this has to be done. In ambulatory care, inpatient pharmacist medications recommendations are well received. Acceptance rates by physicians ranging from 70 to 90%. In community pharmacy, recommendations have lower acceptance rate ranging from 42 to 60. So basic communication, condition-specific interventions, evaluating adherence and regulate particular regulation and time, and reminding processes. Self-management support, psychomotor skills. Polypharmacy is also one of the problems for non-adherence, like use of multiple medications, complex dosing schemes, and cognitive impairment. So there are various case studies pertaining to it. So the patients may be having various problems. So we'll later on discuss it, dosage box. So in the take-home message, you have to be adhere to your therapy as a patient. Whatsoever the social, economic, or pictorial, pictogram, or use of any PowerPoint where the educational videos can be told for the patients, you can run on into it and provide patient and prescriber relationship in OTC case or prescription drugs. Whether it is a clinician, physician, or pharmacist, should give a proper kind of counseling to the patients. And condition related, particularly in which several chronic conditions like hypertension, etc., you have to give a proper counseling. Therapy related, each and everything about the medicine, either it is a chronic state or acute or subacute. Therapy related concerns, then the patient related concerns. And the pharmacist role in this is he can improve about the medicine information, when to take, how to take, possible effects and side effects, duration of therapy. A pharmacist can advise, can educate, can counsel to the patients regarding the medication adherence, and if not so, they can told about the harms. And pharmacist can assign the patient knowledge of their drug therapy. Pharmacist can also assess the patient's availability. And what are the strategies to improve the patient-pharmacist relationship? Be friendly and approachable to the patient, improve communication skills, take into account the spiritual and psychological needs of the patient, improve patient education, give clear explanation, check the patient understanding, simplify the therapeutic regimens, monitor the side effects, monitor the beneficial effects, speak the same language of patient, involvement of patient treatment discussion, monitoring of medication adherence, assessment, quantification, direct indirect methods, like self-reports, pill counts, rate of prescription refills, assessment of patient clinical response, measurement of psychological markers, direct measurement, home finger prick sampling, biological markers, directly observed treatment short course, indirect measurement, self-report measures, Moresky medication adherence scale, medical outcome adherence study scale, brief adherence rating scale, electronic adherence monitoring. These are the short-term courses in this topic. Define the term adherence, define the term compliance, define the terms persistence, define adherence according to WHO, which are the essential factor for adherence. Long-term questions, explain the importance of medication adherence with examples, give the possible reasons that contribute to poor adherence. Very long question answers, explain in detail about the causes of medication non-adherence, explain the role of pharmacists in the medication adherence. So this is all for today. Thank you so much. And okay, so this is all for today. And as I can see the chat, there is no such questions. So thank you so much for joining today. And tomorrow also we'll meet with the lecture number 17 and 18 at the same time. Thank you so much.